right now before you do anything else. Stand up for just a moment. Look down at your feet. Now sit back down and press two fingers firmly into the top of your feet, just above your toes. Hold for 10 seconds. Lift your fingers. If you can see the imprint of your fingers still sitting there in your skin, white and sunken, slowly filling back in like a dent in soft dough. I need you to stay with me, because what you are looking at is not old age. It is not something you simply have to live with. And despite what your doctor may have told you at your last visit, in most cases it is not a heart problem. It is a fluid problem, and the reason it keeps coming back every single evening no matter what you do, is that nobody has ever explained to you what is actually causing it or what to do about it at the right time of day. The fluid building up in your feet and ankles right now did not appear overnight. It has been collecting for hours, quietly a few milliliters at a time, pooling in the soft tissue of your lower legs while you sat at the breakfast table, while you drove, while you watched television, and by the time you notice it, by the time your shoes feel tight and your socks leaves a groove in your skin and your ankles, looks like they belong to a different body. There is already nearly a liter of fluid sitting in your legs doing nothing except making your nights miserable. Tonight, when you lay down, that fluid is going to move. It is going to flood back into your bloodstream. Your kidneys are going to detect it and go into overdrive. And at 1:00 in the morning, at 3 o'clock in the morning, at 5 o'clock in the morning, you are going to wake up and shuffle to the bathroom, exhausted, wondering why your body will not let you sleep. Going to show you exactly why this is happening, what is going wrong inside your legs, and the one thing you can do before bed that will change your mornings within 2 weeks. I am going to show you exactly why this is happening, what is going wrong inside your legs, and the one thing you can do before bed that will change your mornings within 2 weeks. You know the feelings I am describing. You've known it for months, maybe years. You sit down for dinner, you look at your ankles, and they are thick and puffy. You press your thumb in above the ankle bone and there is that crater, that little pit that just sits there. You try to put your evening shoes on and they will not close properly. You lay down hoping to feel better, and instead you spend the night running to the bathroom. You've probably mentioned this to a doctor, maybe more than once, and one of a few things happened. Either you were told to cut your salt, or you were given a water pills, a diuretic, that made you urinate constantly during the day, and did almost nothing for the swelling, or you were sent for a heart scan. The scan came back fine, and you were sent home with no real explanation. Here is the explanation nobody gave you. Your body does not have one fluid system, it has two. Most people know about the first one. Blood leaves the heart through arteries, delivers oxygen and nutrients, and returns through veins. That system has a pump, your heart, and it runs on its own every second, automatically. The second system is called the lymphatic system, and this is the one that most doctors do not have time to explain in a 15-minute appointment. Your lymphatic system is a network of tiny vessels that runs alongside your blood vessels everywhere in your body. Its job is to collect the fluid that leaks out of your blood vessels into the surrounding tissue, pick up the waste products, the cellular debris, the excess proteins, and carry it all back to the bloodstream. Here is the critical difference. Yours, the lymphatic system, has no pump. None. Zero. It moves only when you move. Every time your calf muscle contracts, every time your feet flexes, every time you take a step, you are physically squeezing the lymph vessels and pushing fluid upward. The moment you stop moving, the system slows. After an hour of sitting, it has almost stalled entirely. After 3 hours of sitting, the fluid is just accumulating in your lower legs, with now here to go. When you are young, this is not a serious problem. A short walk restarts the whole system in minutes. But after 60, 3 things change simultaneously. The walls of your lymph vessels become stiffer and less elastic. The tiny valves inside them, valves that are supposed to keep fluid moving in one direction, beginning to weaken and leak. And the soft connective tissue in your lower legs. The matrix that surrounds the fluid and helps contain it begins to lose its structure, so fluid leaks in faster, the drainage system moves it slower, the imbalance grows, and by evening, your ankles show the evidence. Before we go any further, I need to stop and be direct with you. Not every case. Some of ankle swelling is LMPH problem. Patterns of swelling are medical emergencies, and you need to recognize them. If one leg is suddenly dramatically more swollen than the others and it is painful, red and warm to the touch, that could indicate a blood clots in the deep veins. Do not finished this video. Go see a doctor today. If your legs are swelling and you are also having trouble breathing when you lie flat, or you wake up gasping in the night, or you cannot climb one flight of stairs without stopping to rest, that combination suggests your heart may be under significant strain. That is not a home protocol situation. If your legs are swelling and you have gained 4 or 5 pounds in a single week and your urine looks foamy, that combination points to kidney disease, that is, letting the protein escape. That needs blood work this week. If the swelling is only on one side, it is painless, it feels firm rather than soft, and you have a history of cancer treatment in that region, that needs evaluation for lymph nodes involvement. If none of those apply to you, if your swelling is gradual, affects both legs, is worse by evening, is better by morning, and you have no breathing difficulty at rest, then what I am about to walk you through is exactly for you. There are 3 main causes of chronic lower leg swelling in people over 60. The first is venous insufficiency. The valves inside your legs, veins, have awaked and blood pools. Pressure builds and water is pushed out through the vessel walls into the surrounding tissue. You will usually see visible veins, sometimes a browning discoloration on the shins, and the swelling will be worst after long periods of standing. The second is lymphatic insufficiency. This is the most common cause in older adults and the one almost nobody explains properly. The lymph drainage system has slowed. Fluid saturates the tissue. The swelling is soft, pits when you press it, and often affects the top of the foot, the area just behind the toes. In people who have had this for years, the skin on the top of the foot becomes thick and almost rubbery. If you try to pinch it and you cannot lift the skin at all, that is a clinical sign that your lymphatic system has been overloaded for a long time. The third is cardiac or renal swelling. The heart or kidneys are not managing fluid volume properly. The swelling is always equally in both legs. It progresses through the day, and it comes with other symptoms: shortness of breath, frequent nighttime urination, rapid weight gain, extreme fatigue. If your swelling has those partners, you are in pattern 3, and you need a workup, not a home protocol. The majority of people over 60 with chronic evening ankle swelling and no other symptoms are in pattern 2. Let me tell you about a patient I will call Margaret. Margaret was 71 years old, retired nurse. She had spent decades on her feet and now she spent most of her days sitting. For 2 years, her ankles had been swelling by afternoon, badly enough that she had quietly gone up a shoe size. She had seen 3 doctors. Her heart had been checked twice. Her ejection fraction, the percentage of the blood heart pumps with each beat, was 58%, well within normal range. She had been on a diuretic for 8 months. She was running to the bathroom every hour during the day. Her ankles were barely changed. She said something during her appointment that I have heard from many patients since. She said, "The strange thing is, on the days I walk a lot, by evening my feet actually looked normal." That was the entire story in one sentence. Her swelling was movement dependent. Her heart was fine. The kidneys were fine. Her veins showed only mild age-related changes on ultrasound. What Margaret had was a lymphatic drainage system that had slowed with age and was no longer keeping up with the fluid her body was producing. No diuretic can fix that. A diuretic pulls water out of your blood. Margaret's water was not in her blood. It was in her tissue. You cannot drain a swamp by removing water from a different lake. Here is what Margaret Spody was doing every single day, and what yours is probably doing too. She woke up. Ankles looked almost normal. She had been lying flat all night. Gravity was not pulling fluid into her legs. Her Lymph system had 8 hours of minimal load to slowly clear the reservoir from the day before. She got up, had breakfast sitting, drove to her volunteer shift sitting down, sat for 3 hours, had lunch sitting down, watched television sitting down. By 2:00 in the afternoon, she had been upright but almost completely still. For 6 hours, fluid had been slowly leaking from her capillaries into her ankle tissue the entire time. Her calf muscles had barely contracted. The Lymph system had barely moved. The reservoir. Margaret was 71 years old, retired nurse. She had spent decades on her feet and now she spent most of her days sitting. For 2 years, her ankles had been swelling by afternoon, badly enough that she had quietly gone up a shoe size. She had seen 3 doctors. Her heart had been checked twice. Her ejection fraction, the percentage of the blood heart pumps with each beat, was 58%, well within normal range. She had been on a diuretic for 8 months. She was running to the bathroom every hour during the day. Her ankles were barely changed. She said something during her appointment that I have heard from many patients since. She said, "The strange thing is, on the days I walk a lot, by evening my feet actually looked normal." That was the entire story in one sentence. Her swelling was movement dependent. Her heart was fine. The kidneys were fine. Her veins showed only mild age-related changes on ultrasound. What Margaret had was a lymphatic drainage system that had slowed with age and was no longer keeping up with the fluid her body was producing. No diuretic can fix that. A diuretic pulls water out of your blood. Margaret's water was not in her blood. It was in her tissue. You cannot drain a swamp by removing water from a different lake. Here is what Margaret Spody was doing every single day, and what yours is probably doing too. She woke up. Ankles looked almost normal. She had been lying flat all night. Gravity was not pulling fluid into her legs. Her Lymph system had 8 hours of minimal load to slowly clear the reservoir from the day before. She got up, had breakfast sitting, drove to her volunteer shift sitting down, sat for 3 hours, had lunch sitting down, watched television sitting down. By 2:00 in the afternoon, she had been upright but almost completely still. For 6 hours, fluid had been slowly leaking from her capillaries into her ankle tissue the entire time. Her calf muscles had barely contracted. The Lymph system had barely moved. The reservoir was filling. By 6 o'clock in the evening, the sock groove was visible. By 8:00 her ring was tight. By 10:00 she laid down, and the flood began. A liter of fluid started to slowly reabsorbed back into her blood. Her heart noticed the extra volume. Her kidneys went to work. She woke at 1:00 to urinate, then at 3:30, then at 5:00. By 6:00 she was exhausted before the day had evening started. The problem was not her heart. The problem was timing. The fluid moved at night because nobody had ever told her how to move it during the day, before bed on her schedule, while she was still awake. 2 quick tests you can do right now. They take 30 seconds total. Test 1. Find the bony ridge along the front of your shin, about 3 to 4 inches above your ankle. Press your thumb firmly into the soft tissue just beside the bones. Hold for 15 seconds. Lift your thumb. If there is a visible pit that takes more than 10 seconds to fill back in, you have what is called pitting edema. A shallow pit that fills in 10 to 20 seconds is mild. A deeper pit that takes 30 seconds or more is moderate. A significant pit that takes over a minutes is more advanced. Write down what you see. You'll test again in 2 weeks, and the difference will be measurable. Test 2. Try to pinch the skin on the top of your feet, just behind your second toe, between your thumb and finger. If you can easily lift the skin into a fold, your lymph system is moving reasonably well. If the skin feels fused to the feet, impossible to lift, as though it has been glued down, that is called the appositive stemmer sign. It is one of the simplest clinical signs of chronic lymphatic congestion, and it matters. 3 habits that silently make lymph swelling worse. Most people over 60 do all 3. The first is hidden sodium, not the salt shaker. The sodium in bread, in cheese and deli meat and canned soups, in restaurant meals, in bottled sauces. Your body holds roughly 4 cups of water for every gram of. Directly improves the balance of fluid in physics. Your body, magnesium. Most people over 60 are gravely deficient. Magnesium affects the tone of smooth muscles, including the muscles in the walls of lymph vessels. The easiest food sources are pumpkin seeds, dark leafy greens, almonds, and dark chocolate. Now, the before-bed protocol that actually drains the reservoir while you are still awake. This is the center of everything I have been building toward. Pay attention to the sequence. Every part has a reason. Morning. Before your feet touch the floor, while you are still lying flat in bed, do 30 ankle pumps. Point your toes down, then pull them back towards your face 30 times. This takes under a minute. It restarts lymph movement after 8 hours of stillness and prevents fluid from rushing immediately into your lower legs the moment gravity takes over when you stand. Daytime. Every hour of sitting, do 20 calf raises, heels flat. Raise your toes upward and lower them back down. Or, if you can stand, rise onto the balls of your feet and lower back down 20 times. 30 seconds. Set a timer if you have to. This is the single most important daytime habit. It keeps the lymph conveyor belt moving throughout the day and prevents the reservoir from filling in the first place. Before dinner, a 5-minute walk. Not exercise, just movement. Around the block, around your home, around your yard. Walking activates the deep calf muscles in a way that seated movements cannot replicate. Do this before dinner, not after. The critical piece, 90 minutes before bed. This is the part that changes everything. Lie on your bed or on the floor. Raise your legs straight, up against the wall so your heels are above yours. Hips and your hips are above your heart. You do not needs to be perfect. Lie vertical. An angle of 60 to 90 degrees is sufficient. Stay there for 15 minutes. During those 15 minutes, do this in order. Slow ankle circles, 10 in each direction. Alternating ankle flexes, 20 repetitions. Then place both hands flat on your belly and breathe deeply through your nose for 3 minutes. Slow and deliberate. Your belly rising with each breath. That deep breathing matters more than most people realize. The main drainage duct of your entire lymph system, the thoracic duct, runs directly behind your diaphragm. Every deep belly breath physically compresses and releases that duct, pumping lymph upward toward the bloodstream. 3 minutes of slow belly breathing while your legs are elevated is one of the most effective lymphatic interventions that exists, and it requires no equipment and costs nothing. After 15 minutes, slowly roll to your side and sit up, and do one final step, starting at your ankle. Using the flats of your fingers, stroke the skin firmly, upward toward your knees. Slow, deliberate strokes, always towards the heart, never downward. 10 strokes on each leg. This is a simplified version of manual lymphatic drainage. It physically moves fluid from the tissue into the lymph capillaries near the surface of the skin. Within 20 minutes of completing this sequence, you will feel the urge to urinate. You will release 300 to 400 milliliters of pale, clear urine. That is the fluid that would have walked you at 1:00 in the morning. You just drained it while you were awake in control, before it had a chance to disrupt your sleep. Margaret did this protocol for 3 weeks. By day 9, Her sock marks were gone by morning. By the end of week 2 she was sleeping through the night for the first time in nearly a year. By week 3, her ankles at 9:00 in the evening looked the way they used to look at 9:00 in the morning. Her heart scan had not changed. Her medications had not changed. What changed was that her lymph system was finally getting the signals it needs at the right time of day to do the job it was designed to do. 5 things to do starting tonight. 1. Do the pit test right now. While you are watching, know your grade. Write it down with today's date. 2. Identify your single biggest hidden sodium source. For most people it is bread, cheese can soup, or deli meat. Pick the one you eat most and reduce it starting tomorrow. 3. This evening before dinner, take a 5-minute walk. Not after. Before. 4. 90 minutes before bed tonight. Legs up the wall for 15 minutes. 3 minutes of deep belly breathing during that time. 10 upward strokes on each calf when you stand up. 5. Tomorrow morning, 30 ankle pumps before your feet hit the floor. Do this for 2 weeks. Then redo the pit test. The change is not subtle. It is the kind of change you feel in your shoes in the morning and see in the mirror at night. Before you go, I want to hear from you. Leave your age in the comments below. The age of this audience shapes which topics matter most, and I read every comment. And tell me where you are watching from. Your city, your state, your country. I want to see how far the conversation is reaching, and if someone you know has ankles that swell by evening, someone who has been told it is their heart, someone who has been handed a water pills and sent home without aerial explanation, share this video with them. You may give them the answer nobody took the time to provide. Your legs are not failing you. Your drainage system is not getting the movement signals it needs to run properly. Give it 5 minutes before bed. The differences will show up in your socks in the morning, in your sleep, and in the way you feel when your alarm goes off. That is not a small thing. That is the whole day. Share.